we're going to talk about posture and why it's important in your shoulder pain and your shoulder dysfunction. So when you think about it, most of the things in our life are forward, right? Our computer screens are forward, our driving, everything's forward. So the posture tends to go that way if we're not mindful about it. When we think about being here in this position, you're really setting your shoulder up for being in a less optimal position when you want to go do things. So if the shoulder blade or the scapula is rotated in a forward position and you try to lift your arm or go about and do things, it's going to be a little bit more difficult, and you can try it yourself. Being forward in this position, trying to lift the arm, or being a little bit more upright and then trying to lift the arm, it's going to be a little bit more easy. So when we think about the posture and our normal posture maybe being here, we want to start grounding at the feet. So have your feet planted on the floor. We take a lot of support and balance in through our feet and pressing through, especially the big toe. So as you lift up from there, then you come to your sit bones. Your sit bones are those bones that you're sitting on, your ischial tuberosities, and seeing if you can be balanced on both of them. So oftentimes maybe we're sitting, even as we're driving, we're kind of off on one side, or even as we're sitting, or oftentimes we're sitting maybe off like this. So not optimal when you're going to be in a position for a long time, such as driving or at your workstation. So we start grounding at the feet, grounding through the sit bones, being balanced, and then think about the spine growing tall from the pelvis. And from there, the head comes up on top of that, lifting through the crown of the head, and then dropping in the chin slightly, so that the shoulders come back, the neck and ears are in line. And then when you think about, in this position, if you can breathe, try breathing. First we're going to start in a forward position. Try breathing here and seeing how big of a breath that you can take. And then oftentimes we over-accentuate sitting up tall as being up here. So we lift the chin, we thrust the chest forward, and what happens then is the rib cage actually lifts up and puts the diaphragm at a less optimal position to work more efficiently. So it's kind of like Goldilocks and the Three Bears, where you want that somewhere right in the middle, right? Something just right. So not here, but somewhere right in the middle. And we're not perfect little robots. We're not going to stay here all day sitting like this in this perfect alignment. But what you have to do is to become more mindful and aware of your posture throughout the day. So that maybe you're not here all the time, maybe you slump into here sometimes, and that's okay. You think, oh, where am I sitting again? You come up to this position so that you're not there all the time, 8 hours throughout your day, sitting at your workstation or driving in your commute. So think about the shoulders back, spine long, grounded through the sit bones and the feet, and you'll be a much happy camper when you go to try to do your sports, your activities, and the things that you want to do.